This is Dr. Marshall Green at The Aesthetic Face. I'm here today with you in our med spa, Numa Spa. We're in Oyster Point, Newport News. We're here today to do one of my favorite treatments. This is called Profound. Profound is a radio frequency combined with microneedling that goes deep down to the layers of the face and body, if you do body work, to lift and tighten the skin. It's probably one of the only ways that we can lift and tighten skin without surgery, because some patients do absolutely need a facelift. However, this is a great option for folks that either aren't quite ready for a facelift or don't want surgery. So I'm going to walk you through several parts of the procedure today as we kind of go through this. I'm also going to be combining the procedure today with Perioral CO2 laser resurfacing, so lasering around the mouth. We're going to be using the core from Syneron Candela today, a really neat device. I'll talk to you a little bit more about that as we use it. We're going to start right off though with some administration of some local anesthetic. I've injected a little bit, but I'm going to show you what we're doing here. So this is a multi-port injector, has multiple ports in a single injector. These are mesoram needles. And they can be used here. I'm going to kind of show you a couple areas. We're going to insert into the skin, and we inject all 3 ports at one time. So we'll do this over the whole face. And I wanted to start earlier just to kind of show you, this is the area that we're going to be working in to start, and you can already start to see it blanch from the local anesthetic that we've applied there. Did use a little topical to get started, but this will be the facial portion of our procedure. I'll kind of come back and show you a little bit more in a minute. All right, thanks so much. Treatment on the right hand side here, so you can watch me. This is the Profound hand device. The needles, I'll show you here, come out. There's 5 pairs of needles. Each of those needles go to a specific layer of the dermis and heat up between the two to 67 degrees Celsius, was a temperature at which collagen denatures and we get healing. That's where we get our lifting and tightening. So these will retract. This is a cooling plate across the top that goes on the skin to help keep the actual skin cool while we heat up the deeper portion of the skin. So here you're going to watch me just march the device forward. Across the face. So I'm not going to have you watch the entire procedure because that would take a little bit of time, but quickly what I'm going to illustrate to you is we're going to work in a couple of vectors just like we use vectors in a facelift. So we'll work from this vector here all across the jowl and the jowl and the jaw, and then we're going to come all the way up, same thing here, and then I'm actually going to change the vector and go in this direction. Call this cross hatching. This creates lift in the vectors in which we're working so we can get the lifting and tightening of the face that we want to see, or what we typically would do a facelift to get. Okay? All right, that's all for now. I'll bring you back later. Thank you. Horizontal pass, and I actually am almost done with the second cross-hatching pass, the vertical pass we talked about. So as I mentioned previously, we came across in this direction. Now we finished up about our last pass in this direction all the way up and down. So we've cross-hatched the entire face. So this is our, one of our last little pulses here in the jowl area. One of the areas we obviously try to hit the hardest and lift the most. Now this particular patient, we did speak extensively about her crow's feet. There's a lot of superficial veins in this area, but if a patient's okay with the risk of a little bit more bruising in this area, we put some local anesthetic here. We're going to go ahead and treat the crow's feet region as well. So I typically talk, like I said, about bruising with these patients specifically, but here we are, we're going to treat the crow's feet area to get some lifting and tightening of the crow's feet. Something that's really hard to accomplish without, Botox does great for early crow's feet, but once they're well established, other than surgery, there's not many options. Now we have Profound. All right, we'll be back with some more in just a few minutes. Hey there, so we're back here, Dr. Green, tuning in. So what we've done so far, we've completed Profound to the right face, we've completed Profound to the neck on both sides, we've even gone to the crow's feet area, and we've treated both sides of the face. Now we're going to come around the mouth with what I like to call like the icing on the cake, and that's to hit the lines around the mouth with the core laser. So what we're going to be using the core, we're going to be using a setting called Fusion. One of the nice things about the core is that you can both do superficial laser resurfacing by also going down deep into the tissue. So if you're familiar with cutting grass, we cut the top off the grass and we're also aerating the lawn at the same time. So kind of look over here at our screen, you can kind of see this picture right here. So this is the superficial aspect where we're taking the skin down, and these are these deep spikes that go deep down to the tissue, aerating the tissue, and help us get a nice result around the mouth. So here we are. I'm going to bring in the patient. You ready? Okay. All right. All right. So coming close here, you can kind of see the pattern that we've created. So we're going to do this all the way around the mouth. I had the smoke evacuator turned off for the sake of sound. But we're going to turn the evacuator on, and we're going to get to work here, and we'll bring you back when we're all said and done. Thank you. All right, so we're all done at the end of our treatment here. We've done profound to the face, jowls, neck, and we've done some perioral CO2 laser resurfacing with the core. So how did we do overall?
Fine.
You survived?
I did.
Okay, all right, very good.
Thank you.
Yeah, my pleasure. All right, very good. So thanks for tuning in with us today. Once again, it's Dr. Marshall Green, the aesthetic face, with profound non-surgical face and neck lifting and tightening, combined with some perioral CO2 laser resurfacing with the core device. Thanks again for checking us out.